Great, Tara. It's wonderful that we're able to talk about some issues related to vaccines. One of the big ones is the AstraZeneca, and people are getting confused. And this is one of those areas where basic clinical science butts up with public health and the issue of complications and difficulties against the benefits. You're a tremendous scientist. How do you put this together?
What we're seeing right now is a pause in the vaccination, the use of the AstraZeneca vaccine in people under the age of 55. This doesn't mean that after investigation, it won't turn out that the vaccine isn't safe. The point is that the investigation has to be done. Now that there are some potential safety signals that have come up in Germany at the end of last week that were reported. So we have to look very carefully at that. And we need to let the regulatory agencies and those who are expert in this area do the work, do the investigation. We need to be a little bit patient. The other thing that's very important for people to remember is that the reports of clotting that have been reported in Europe haven't been seen in all countries. They haven't been seen in the UK and other places. And they are extremely rare. The risk at this point appears to be very low, and it may be that we're going to have to balance the risk of COVID-19 to our health versus these extremely rare risks of blood clots if these turn out to be linked to vaccination.
So basically, what you're saying is this is how the system is supposed to work. So let's let the system
Exactly.
do it.
This is normal. This is normal for any kind of medication that rolls out, any kind of vaccine. It's not something that we should worry about a lot until we hear from the regulatory agencies and let them tell us after they've looked at the evidence.